So, greetings to you, Miss. We are Group 3, and this presentation is brought to you by myself, Tiffany McFarlane, Shaniel Salmon, Shauna Watson, and Monique Brown. Now, this presentation will be on febrile seizure. So at the end of this presentation, we hope that you'll have an understanding of febrile seizures, as well as you'll be able to state the management of febrile seizures, as well as to identify the Brudzinski and Kernig sign and how they are assessed. And last, we want you to be able to identify the possible nursing diagnosis for febrile seizures. So, what is febrile seizure? Now, a febrile seizure is a convulsion seen in children. It is caused by some type of infection more often than not. It is most commonly seen in kids who are children whose family has a history of febrile seizures, or children between 6 months to 5 years, with greater risks being between 12 and 18 months. Now, some signs and symptoms of febrile seizure includes a fever higher than 100.4 degrees Fahrenheit, loss of consciousness, twitching or jerking of the arms and legs, breathing difficulty, foaming at the mouth, going pale or bluish in skin color, eye rolling, so basically only the whites of the eyes are visible. Now, when assessing a child with a simple febrile seizure, or one should concentrate on identify the cause of the child's fever. Now, meningitis should be considered as a differential diagnosis. Now, the Brudzinski sign is one of the such sign that is used to test for meningitis. Now, Brudzinski sign is one of the physically demonstrable symptoms of meningitis. It is characterized by reflective flexion of the knees and hips following passive neck flexion. Now, how do we perform the Brudzinski sign? We first thing place the patient in a supine position. We then lift the child's head and flex the neck towards the chin. Now, involuntary flexion of the hips and knees is a positive sign. Another sign that can be used to check for meningitis is the Kernig sign. Now, this is one of the physically demonstrable symptoms of meningitis. Now, severe stiffness of the hamstrings causes an inability to straighten the leg, when the hip is flexed to a 90 degrees angle. How do we perform or get an positive Kernig sign? We place the child in a supine position. We then flex the hip and knee to about a 90 degrees angle. We then slowly extend the knee. No resistance or the inability to extend the knee beyond the 135 degrees angle is a positive Kernig's sign. Now, some treatment for febrile seizures include we place the child on the floor, on a flat surface where they cannot harm themselves. Then we remove any nearby objects, and then we always put the child in a recovery position. As a matter of fact, anyone who is having a seizure, we put them in the recovery position. Then we also loosen any tight-fitting clothes around the head or the neck, and we watch for signs of breathing problems, including if there's any bluish color in the face, which would signify that there is not oxygen being circulated. Next, we support the child's head with some form of soft cloth or pillow. And lastly, we administer anticonvulsant drugs such as valproic acid. Now, some possible nursing diagnoses for febrile seizure include ineffective airway clearance, hypothermia related to viral infection, risk for injury, altered level of consciousness resulting from. And this is the end of our presentation. Thank you for listening. And here are all our references.